Dr. Walter, thank you so much for speaking with me.
Shirley, thank you for having me.
Largely, a lot of schools are virtual. Some are in person. Is it safe for kids to be back in the classroom?
So we get that question a lot. The answer is a qualified yes. Everybody has their own circumstance. Every family has their own bubble. There could be grandparents, there could be people with illnesses, people with jobs that if they had a quarantine, it would be a huge issue. So you have to look at it that way. I do think the risks of not going to school are real. And my best response when people talk about schools is that they offer some kind of in-person or hybrid, but they also offer totally virtual for families that have different reasons for not going in, not being comfortable to go into school.
Some kids in the classroom, obviously we want them to wash their hands. Should they be doing anything more aggressive, like changing their clothes, showering? What's your take on that?
I'm not going out of my way to say, okay, they need to come home and they need to change everything. I think we're finding more and more, despite what some people are trying to push, that this is an aerosolized type of a virus, that it's much more issues through the air than through contact. But having said that, I know a lot of families say, you know what, they get home and I'm scrubbing them down, and that makes sense. And they're doing that for themselves when they go to their jobs. Most of my families are not doing that, and I've not seen any guidance from the Academy of Pediatrics and others saying that that is, required or necessarily necessary.
The New York Times has reported on this study where it was basically saying kids are loaded with the virus at the same levels comparable with adults. I mean, they're just like these little germ repositories. What do you think about that, and how contagious are kids?
We don't know. I mean, people can spout about things, but there's a lot we don't know. A lot of those studies came from Asia and they came from Europe. And we do know it was surprising that kids don't get it as much. They don't seem to spread it. So it was a big surprise that they were teeming with some of these viruses. But that doesn't mean that it's going to be a super spreader event. With influenza, kids are the super spreaders. That's where grandpa gets it from the kids. It doesn't seem to be that way. So we get all this data, it makes us even more careful about things and being very measured about what our recommendations are. But it doesn't mean that all of a sudden kids are super spreaders. It does mean, again, put a mask on. And the AAP, the Academy of Pediatrics, has recommended any kid over 2, if they can do it, should wear a mask. And we've had schools around here who are not requiring masks for 5 or 6-year-olds. And I tell the parents, call the principal and say, that's not right. So more studies come out, they don't seem to be big spreaders, even though they can have it in their nose, but you gotta be careful, and the kids should wear a mask, and you should practice at home. Just because they have it doesn't mean that it's gonna become a spreadable event. Is it possible? Yes, there's been reports of people getting it from their kids, so there's no absolutes here.
Does it seem like kids to you are better able to fight this virus than adults?
The data shows that. Certainly in an individual practice, we've had some cases and they've done fine, but you got to look at a population, and they seem to not get it as much. They seem to be more likely to be asymptomatic. And when they are symptomatic, it seems to be milder. It doesn't mean that they can't get real sick, as we said. It doesn't mean that they can't spread it, but it just seems to be less. And 5-year-olds are less than 10-year-olds, and 10-year-olds are less risk than 15-year-olds. So, the age spectrum makes a difference.
All right, Dr. Walter, thank you so much for your time.
Thank you, Shirley. This is great. And everybody out there, and you ought to know, audience, be safe. Wear your mask. Please, wear your mask.
Hi, I'm Shirley.
And I'm Regina Mitchell. For more videos like this, subscribe to WHYY.